and so my optometrist sent me to you. And I was in really bad shape at the time. I really wasn't driving at night for about a month. So coming to see you, you started me out with something I'd never even heard of called the IPL. And I think within about 30 hours, 24, 36 hours, it was pretty amazing. As my family I was traveling with at the time could attest, it made a huge difference. So that was how I started with you. And so every 6, 7, 5 weeks or so for the last year or so, that's what you and I have been doing. And it's been great. But again, I don't know if degrade is the word or not, but I do tend to degrade after those treatments after a few weeks. So you had some other recommendations. So for the LipiFlow, right? Yep, LipiFlow, which is what we did about 2 months ago then, to the day. You saw me here on a Saturday, actually, and we went through the process, just nothing like getting the inside of your eyelids massaged, but that's basically what the procedure was. And again, 2 months, just about to the day that we did that, and I feel like I'm just a week out, but I know how I feel, and I can't imagine living through a year without having had the IPL and then the LipiFlow. I'm happy with the results so far. So,
is this the best you've felt in a while?
Oh yeah, oh yeah. I can't even really remember how bad it was. My friends can tell you I was a different person in terms of my normal activities. It was no fun. So, and work stress. So it's not just made me feel better. It's relieved a lot of stress to be able to feel normal, if you will. And like even in the last 2 months, I think I've used eye drops one time, but I normally was using eye drops fairly frequently. But I think on that front, even the LipiFlow has made an even better improvement in how I feel.
Had we had this machine before, do you think we should have done it earlier?
Well, you know, I don't know. I certainly don't regret it. And I feel like I was getting good results with the IPL, but, you know, I mean, it's not an insignificant investment of time and money on, you know, both our parts to come have those treatments every 5, 6, 7 weeks. So, I mean, with my money, I'd rather spend it and the time doing a treatment that is proven, or seems to be proving, right, to be a longer lasting, just as effective treatment for me, if not better. So that's my 2 cents worth.
Well, thank you very much. Is there anything you'd advise patients that are sort of just suffering with this condition?
I would say if you're one of the hordes of people who've been told Restasis is the end-all, be-all cure for everything, who knows, it may be, and you may in fact have whatever the condition is that will remedy. But if you don't get relief, I don't know what the period of time would be, but go see somebody else. That's what I would recommend. Don't take dry eye, air quotes, as an answer to how you have to live. I didn't, and I'm glad.